reviewing CMS Quality Measure 112, breast cancer screening. This is a telehealth eligible measure. The definition of this measure is the percentage of women 50 to 74 years old who had a screening mammogram in the 27 months prior to the end of the current measurement period. This includes primary screening only, not biopsies, breast ultrasounds, or MRIs. The workflow for this measure is as follows. You're going to check to find if there is a mammogram in the system and if it has been reviewed as part of the structured medical record. If it has, you've met the measure for the year. For instance, if I go into diagnostic imaging and there's a mammogram in there and it has been appropriately reviewed, there's a little click next to perform date, it's been received, and this information has been saved. This information is enough to meet the measure for the year. If you have ordered a mammogram and it was not received electronically, or you got it from off of a radiology portal, or the patient brought in the information, etc., then you are going to have to create a structured diagnostic imaging result on your own for the mammogram. To do this, we'll go up to the CDSS alerts, click on CDSS at the top of the screen. We will see mammogram in here. It's red, indicating that the patient is due. I will click on history to initiate creating a record. I'm going to change the date here to the day the patient had the mammogram done. And then click on record lab values and OK. This will open up what you recognize as a diagnostic imaging result field page. I am going to change the dates of performed and results received to match the order date. And make sure that this tiny little box next to perform date is checked. So this is seen in bold rather than grayed out. That is important for the computer to be able to process that this has been done. I've changed this. I will review it, receive it, timestamp. If I want, I can add results here, but I don't have to. And hit OK. Now you will see that this has turned green. And if I look up into diagnostic imaging, I will see a locked and reviewed mammogram result as though it was ordered and received through the EMR. That's all that needs to be done to meet the measure. Now, there are exclusions for this measure, and the first and most easiest one to document is that the patient has had bilateral mastectomies. This is done through our clinical quality flow sheet. You open it up and you go down to screening and open up this field. You will see mammograms. Here you're going to see the one that I just created. Down here it says mammogram screening, not done reason. You can click on here and it gives you the option to answer that in here, medical reason, and it will prompt you to select that the patient has had either bilateral mastectomies or double unilateral mastectomies, resulting in the same exclusion. The other exclusion for this, let me go and tell you that if you enter bilateral mastectomies in the patient's medical problem list, this will save this, and each year, with this being an active diagnosis, it will automatically exclude the patient. You will not even see, you will not be even able to find mammograms on the patient's list. See, it eliminates them altogether. We only see their colon cancer screening options. So if you can keep that in the problem list, not only will you not ask the patient every year, you will automatically have an exclusion. Now, the other exclusions for this measure are the frailty exclusions and hospice care. So hospice care, as we know, you select down in the bottom, very, very bottom of the clinical quality flow sheet under Other. There's an option for hospice care. I'm not quite sure why it's not there. Oh, because the patient has a history of the bilateral mastectomies. The frailty exclusions, you are going to have to manually enter in visit code. I have 2 frailty diagnoses here. I just put in frailty in general, and this patient has a diagnosis that of a lung cancer and meets the frailty criteria. There are 3. One is that the patient is 66 years and older and has an institutional special needs plan. The other is that the patient is 66 and older and has a frailty code and medication prescribed for dementia. And the third is that the patient is 66 years and older with a advanced illness diagnosis. You can find the details for this in the written workflow that are linked to this document that you received. So I am going to, after putting the 2 frailty codes in the assessments, I will go down to visit code, and under add CPT, there is a billing category list to the side here. I will go under macro exclusions, and in here I will find the appropriate frailty code. Here it is, greater than 65 with frailty and an advanced illness diagnosis. Select it, click X. Here I've got it in now in my billing. It is a non-billable code, so I don't have to worry about it. And I will link it to these 2 frailty diagnoses I have in here. And in this way, I have also excluded the patient from the measure if it is not appropriate to screen this person any longer. And that is the end of this measure. Thank you for your attention.